Hello and welcome to In Case You Missed It. So everybody blames insurance companies when health insurance gets more expensive, but I got a stat for you that might surprise you. So new research from the Kaiser Family Foundation shows hospital prices for people with private insurance rose 30% since 2019, while Medicare rates only rose 21%. That is a 47% faster rate of increase for those of us with private insurance. And here's the crazy part. Private insurance plans are often paying hospitals around double the Medicare rates for the exact same services. And in places like California, you can see up to 250% higher reimbursement rates. So when your premiums go up, it's not always just a greedy insurance company. I know I'm just an insurance company shill, but the truth is it's hospital rates and the cost for care that's driving a lot of these health insurance increases. So sometimes the real story is what hospitals and insurance are negotiating behind the scenes. Think AI in healthcare means robot doctor, Nope, it's not even close. The biggest impact right now might actually be in hospital billing. So, new data showing 37% of health systems are already using AI behind the scenes to manage billing and revenue processes, and 45% are using it to fight claims. This is small compared to what we will be seeing. Hospitals are using this all over the place to catch missing information, appeal denied claims, and recover more money faster. RFK Jr. dismisses leaders of the U.S. Preventative Services Task Force. Vice Chairs John Wong and Issa Davis, both doctors, were dismissed from the task force to protect the integrity of the task force work. All right. But back in July, the Wall Street Journal reported that Kennedy planned to dismiss all 16 members of the USPSTF because he views them as too woke. All right. Now, so this is a task force that was started in '84. This is a group of doctors that generally provide guidance to insurance companies across the country on what should be considered preventative care. There is only 8 sitting members still on the task force. 5 others saw their terms expire. The prevailing wisdom is that Trump is letting all of these people expire and dismiss them so he can stack the deck and get the people that he wants onto this task force. This is the task force, again, that issues all the recommendations that insurance companies will put into their policy. This year, they issued fewer recommendations than they ever had, and they missed a deadline, a legally mandated deadline to report to Congress after Kennedy indefinitely postponed all meetings. So interesting development there. The Supreme Court declines to hear drug makers' challenge to price negotiations. So the pharma companies wanted to block Medicare drug discounts, something that's been in effect for just a little while, arguing they had protected property interest in setting prices. The Constitution, as you probably do or do not know, requires government to pay fair compensation when taking private property for public use. So private drug companies using their drugs to go to Medicare, which is a public use system. The lower courts contended that companies' participation in the program is voluntary, where drug makers said it's not voluntary. It's only voluntary in name only, because if they want to sell drugs to Medicare beneficiaries, they have to comply. Negotiated prices are already projected to save 9 million people on Medicare 1.5 billion in out-of-pocket costs, while saving taxpayers 6 billion. This is just in 2026. So I would imagine we're going to see this rejection stand, and big pharma is going to eat these discounts. The Senate Health, Education, Labor, and Pensions Program Health Committee, chaired by Senator Bill Cassidy, loses his primary. So this casts a very different trajectory over what's going to happen. One of the biggest groups that help decide public policy going forward. Cassidy was generally seen as a level head in the Health Committee and got crossways with Trump when he voted to impeach him after the January 6th riots. Ever since then, he's been on Trump's radar. Tried to get back in the good graces by confirming RFK Jr. Ultimately got sideways with the Maha movement, and they threw their money and their time behind the candidates he ran against in the primaries. So some suspect that now that he's a lame duck in the Senate, he's still got several months as the chair, that Cassidy will become a much stronger opponent of RFK and Trump, while keeping control of the confirmation pathway for an unusually large number of government healthcare leadership vacancies. So for those of us in the middle that want level-headed politics and policies, having a lame duck Cassidy could be very good in the short term, but we are likely to see a very Maha heavy person in that leadership role once we get into the next Congress. Bipartisan lawmakers reintroduce a bill barring PBMs from owning pharmacies. So the bill is called Patients Before Monopolies. They're always so clever. The acronym, of course, is PBM. So this would be the PBM Act that would go after PBMs, pharmacy benefit managers, and it would force any PBM to divest their ownership of any pharmacy. So Representative Dianne Harshberger from Tennessee, who is the bill's lead sponsor, says when the same corporate giant that sets reimbursement rates also owns the pharmacy collecting them, that's not a free market, it's a rigged one. So the idea here is separating the pharmacies from the pharmacy benefit managers so that the end result is lower prescription drug costs for regular Americans. And to me, as you know, if you're watching these, prescription drug costs are the number one problem in the healthcare space. So that's it for this week. See you next week.